We have so far covered the macroscopic side of a urine test, and now I'm going to talk about the microscopic appearance in a urine report. As I've said, the microscopic variables are there to confirm what you see macroscopically, and you just want to prove whether these different findings they match or not. So the first one is the presence of pus cells in the urine. Pus cells in the urine mean that there are presence of white cells. The pus cells, in fact, they are the distorted WBCs, or the broken down, or the dead WBCs. Normally, we can get 0 to 5 pus cells in the urine. And the presence of pus cells in greater amount means that there could be an underlying urinary tract infection. But once again, this has to be linked with some of the other variables on the macroscopic side. Not all pyuria is significant for, or it means that there is urinary tract infection. In fact, there are conditions in which we can get pyuria without there being actually a urine infection. So if you've got numerous pus cells in the urine, you must always go and see whether there is blood or not. You must always confirm whether there is nitrate or not, and there is leukocyte esterase or not. And not only that, you must also look at the specific gravity. You must always look at the pH, the turbidity, the appearance, because just the mere presence of pus cells, it doesn't mean much. Quite so often, we see urine examination reports in which we've got like 10 to 20 pus cells, but all the other variables are entirely normal. And fortunately, even then, these patients are treated for a suspected urinary tract infection. So the pus cells can be present in a lot of conditions. They can be present in infections. They can be present when somebody takes certain medications, when somebody's partially been treated for a urine infection, the presence of stones. In fact, if you haven't got evidence of infection in the urine, then this is called a sterile pyuria. One of the commonest causes of pyuria is sterile pyuria. In sterile pyuria, as the name indicates, you do not have infection, but you've got just pus cells. And there are different causes for that. But one of the most important causes for sterile pyuria is what is called as GSM. And this is something which all physicians must remember. This is GSM as one of the commonest causes of sterile pyuria. And GSM stands for genitourinary symptoms of menopause. And this is present in about 70% of all women who are in the post-menopausal age. The estrogen deficiency causes a trigone of the bladder to atrophy, and it also causes atrophic vaginitis, and they themselves cause irritation in the bladder, and thereby the presence of pus cells. I have come across patients who've been treated for a urine infection for many months. In fact, one of the patients had it for 2 years, and she continued to have pus cells. So these are the patients who've got GSM. As I've said, 70% of the females will suffer from GSM at some stage. They are treated with estrogens, topical as well as systemic, and not with antibiotics. The other causes of sterile pyuria, that means pus in the urine without any other variables, that is renal tuberculosis, interstitial nephritis, and kidney stones. And if somebody takes multivitamins, especially calcium-containing multivitamins, they are the ones which cause sterile pyuria. So always remember, sterile pyuria is an entity. Never forget that, and you must always keep that in mind. The presence of RBCs in the urine denotes that there is not normally we don't normally have any RBCs, but sometimes we can have up to 5 RBCs. In women, it's more common, obviously, because of menstruation. In men, you don't often get RBCs in the urine, but the presence of RBCs in the urine more or less confirms what you saw macroscopically. And if the RBCs are present, this is then confirmed as hematuria, then it should be investigated accordingly. The presence of pus cells along with RBCs is more likely to be because of an irritant focus in the renal tract, like a stone in the renal tract could be because of infection, and could even be because of a tumor. Epithelial cells are fairly common. Men have more epithelial cells in the urine compared to females. The cause is not known. But if you've got significant epithelial cells in the urine, then this is likely to be because of a urine infection. So always match that with RBCs and pus cells, because if there is infection, inflammation, the epithelial cells will be shed from the lining of the urinary tract, and so therefore you'll get the more. So do not ignore the epithelial cells, but the epithelial cells on their own, they perhaps of no value. But if there are epithelial cells, then it helps if you can just glance on the pus cells and RBCs and all the other variables on the microscopic side, and this helps in making a diagnosis of whether or not they've got infection. Casts, we know that there are two kinds, hyaline and granular casts. This is when the proteins, they come along the renal tubules and then they attain a certain shape. The casts virtually almost always mean that there is a glomerular disease, and so therefore this requires investigations. Crystals are very common. In tropical countries, you often get amorphous urate crystals in the urine. It also depends on the culture as well, on how much milk they drink or how much solutes they take. But crystals as such do not have any value unless you've got these positive as well. Bacteria are fairly common. If you get bacteria in a pregnant woman, this must always be confirmed with an MSU. If the MSU shows the presence of bacteria, it must almost always be treated in pregnancy because of the risk of premature delivery and other complications. Otherwise, presence of bacteria on its own, especially in elderly, in which it is difficult to collect a urine sample, it doesn't really mean much unless you've got the other variables which are present. So in summary, microscopic appearance, we've got pus cells, RBCs, and epithelial cells. If you've got pus cells, please, no matter how many they are, numerous pus cells, do not diagnose as a urinary tract infection. Always look at the epithelial cells, always look at the RBCs, always look at turbidity, the nitrate, the leukocyte esterase, and where possible, do get a history because these pus cells will be positive. For example, if somebody is catheterized, they've got a urine bag, they will have numerous pus cells. Do not treat them with antibiotics. And if they've got RBCs or epithelial cells, they must all be correlated together before you make a final diagnosis.